Welcome to the Beverly Hills Plastic Surgery Podcast. Once again, I'm here to talk about plastic surgery with my most incredible and dashing co-host, Millicent Ravello.
Good evening. I don't know that I've ever been called dashing before, but I accept.
Well, I'm looking at the combo of the leather jacket with the hoodie.
Well, you know, it's cold out there in LA tonight. It's like in the 40s.
It seemed very much like you might be a fighter pilot or some sort of, war hero. So
all right,
dashing came to mind.
Thank you.
We're going to talk about buccal fat excision.
You sure are.
Which is not dashing, but it's actually a great procedure.
Yeah, it actually can be. So buccal fat pad. Want to tell us where and what the buccal fat is?
So the buccal fat is located in the cheek. It is basically in the region, if you were to imagine where your teeth come together, that's actually called the bite line. And right behind the bite line in your cheek is the buccinator muscle, which is one of the muscles that helps you with chewing your food and moving your mouth around and speaking, etc. But right behind that muscle, if you were to make the incision inside the mouth and go through the muscle, you can get to the buccal fat pad. And typically, it pops out like a walnut out of your cheek. You are able to extract it, and it really changes the shape of the face a lot.
So that's why people do it. It's, it can be done in anyone, but there are certain patients that just have a excessively large buccal fat pad, and it contributes to making their face look very round with a lack of definition because they have this sort of bulge or extra volume right below the cheekbone. So if you're looking at your face from the outside, you were explaining where it is, from the inside. But if you're looking at your face from the outside, it's that fullness that's right below the cheekbone, and which prevents you from having that nice definitive hollow that kind of contours the face. So patients that have a large buccal fat pad would benefit from having it removed because it gives their face more contour and more definition.
That's exactly right. The problem is knowing who this procedure really is great for.
Right.
Because in general, you don't want to take volume out of the face because you're going to lose volume over the course of your life anyway.
Right, and you may need and you will want to have volume in your face as you get older. So theoretically,
refer back to the fillers podcast that we did about putting stuff back into your face to add volume.
Right. But you can take the buccal fat pad out of anybody, but you're right. There is a certain cohort of patients that would benefit most, and it is those patients that have a excessively large buccal fat pad and would benefit, and their face would look more contoured if it was removed. So that's the patient.
Yeah, the more rounded faces. I find I do this a lot in patients a lot of Asian patients, I do this in a lot because they complain that they don't have that definition through the shape of their face, especially, Southeast Asians. There's all sorts of different populations. I mean, I hate the term Asian. It drives me crazy because, there's so many different areas of Asia that people are from that have that
very
sort of face shape.
Features.
Yeah, I mean, you have to be kind of like a hack anthropologist to really understand how people's faces are built. Especially with my nose practice, I always talk about how I can figure out how much septal cartilage somebody's going to have based on where they're from.
No, it's true.
Because there are certain parts of the world that, patients have almost no septal cartilage. And then there are other parts where they got enough cartilage to fix, 3 noses. France. No, that's not a dig on France. I'm just kidding. But there are other people that have lots of septal cartilage other than the French, but that's one population where it comes to mind that you have so much cartilage. So with the shape of the face, you really imagine that if you're going to take out that fat pad, will it create that definition through the cheeks? Will you see more of the zygoma, the cheekbones? And will it narrow the face in a way that is attractive for that patient?
Sure.
Just because somebody has a rounded face or big cheeks doesn't mean it's going to make them look better by taking out their buccal fat pads.
They may just have excess, fat all over their face.
Absolutely.
And that's not going to benefit them much. But so the question always arises then, because we sort of brought it up, will this be a problem for the patients down the road?
Well, it can be. If you take out that volume and the cheek sags, you can actually see more of a jowl if it's not the right thing to do for that person. I haven't seen a whole lot of that. I've been very conservative about who I do buccal fat excisions on, but I think I've seen other people where they probably shouldn't have had it out, and they were already seeing a little bit of a jowl, and they were already seeing a little bit of aging, and then somebody takes out the buccal fat pad without, the setting of a facelift or whatever, and they wind up with a saggy face.
Right. So this is usually done in younger patients because they can tolerate it. They have the elastic skin. It's less well tolerated in the older patients. But do you think that in a younger patient that has their buccal fat pad removed and they have an excellent result and they get the contour they want, will it affect them when they're 50? Are they going to look excessively hollow?
Usually not. I think that's the key, is if you do it in the younger patients, the 18 to 40-year-old patient, maybe 45, you're going to be okay. I think once you get into the age where the skin elasticity, especially here in California, where everybody's, been baked in the sun and they have, inelastic skin to begin with sun damage, it becomes harder for that to look great.
Sure. Right. And so so we've sort of talked about who's a good candidate for it and why and when we should do it. But then let's talk a little bit about how you do it. I mean, what kind of procedure is this? I think this can be done a couple of different ways. We talked about this earlier. You can do it under straight local. You don't have to go to sleep for this.
For sure.
So you can come in, have a little bit of, anti-anxiety medication, maybe some pain medication by mouth, get relaxed, get comfy. And then it's sort of like you're at the dentist office. We'll inject some lidocaine, numb up the mouth a little bit, and then you won't really feel anything. It's, a 30-minute procedure, and then you're good to go.
And there are no drills. So I differentiate it from the dentist where I've been recently, and there are no drills, and it's pretty straightforward. Again, it's just behind the buccal ear muscle, so a small incision in the inside of the cheek, through the muscle, and then the fat pad really does kind of shell right out. And they can be pretty big. They can look like an egg yolk, basically,
right. It can
or
be
bigger.
Surprising how much comes out.
Oh yeah, and they just keep
keeps
coming. Yeah, it's and then when they do, you put a few stitches in, close it up, soft food diet for 3 or 4 days, rinse after you eat, and that's about it. It can also be done under anesthesia when you're doing other things.
Yeah,
so I always like it as an add-on, especially when I'm doing a rhinoplasty or brow lift, facelift, neck lift, neck suction, whatever. But it's a great add-on procedure if you really want to narrow the face and get that definition. There is nothing more effective than buccal fat pad excision because it is so dramatic.
That's what it's there for.
I have a video on YouTube, as a matter of fact, of the technique. I think I sent that to you the other night. Didn't I send it to you and said,
yes,
check this out?
You did.
So it's pretty straightforward to do, but the trick is to kind of know where you're going and where you can find that fat pad. I saw a patient one time where they said, I had a buccal fat pad excision. And I said, let me see how the incision's healing. And they pulled up their upper lip.
Oh, no.
And I was like, that's not where the buccal fat pad is. And it was a gingival-buccal sulcus incision, so up above the teeth.
Yeah.
And I was like, I don't know how to get to the buccal fat pad from there. Maybe you can, but I think you got to do some rooting around if you're going to do that. So, well, anyway, and do you give antibiotics for that kind of a procedure?
I do. That's the thing with the mouth. The mouth is dirty. It has bacteria in it. It's never going to be a clean procedure.
No, you have to do it.
I give antibiotics.
I mean, it's a high blood supply area in the cheek, but I would too, just because the saliva is bathing your incision with mouth bacteria. And Listerine can only do so much.
That's
so.
right.
All right. Well, I think we covered it. If you have any questions, obviously you can find Dr. Ravello and I on our websites. You can go to ravelloplasticsurgery.com or drcalvert.com. And obviously on our Instagram, you can direct message us if you have questions. And for now, anything else, Dr. Ravello? I
think we covered it.
Excellent. Well, we'll see you next time on the Beverly Hills Plastic Surgery Podcast. And we are coming to you from the 90210. The Beverly Hills Plastic Surgery Podcast is brought to you by Rock Spa. This is MediSpa, located both in Beverly Hills and Newport Beach, providing services such as Botox, fillers, lasers, and all therapy, as well as hydrofacials and all the aesthetic products you could possibly need. It's run by the medical director, me, Dr. J. Calvert, Rock Spa Beverly Hills is located at 120 South Spalding Drive in Suite 340, Beverly Hills, 90212. The phone number there is 310-777-0496, and Rock Spa Newport Beach is located at 1617 West Cliff Drive, Newport Beach, California, 92660. The phone number there is 949-644-1111. You can go to their respective websites, rockspanewportbeach.com or rockspabeverlyhills.com. Rock Spa was created to help my patients maintain their aesthetic beauty in between whatever operations they have throughout their lives. It's something that allows patients to come in, get their facials, skin treatments, take care of all the Botox fillers and lasers that they need to keep up their beauty, and if they've invested in any of the aesthetic operations I perform, it's the way to maintain those operations. If you mention this podcast, you will get the members' pricing for your hydrofacial. The Beverly Hills Plastic Surgery Podcast is the way that Dr. Ravello and I talk about the issues that are important to us in plastic surgery. But there's nothing better than getting to take care of our patients and do plastic surgery. Our practices are located in Beverly Hills, and I also have a satellite office in Newport Beach. If you'd like to get more information about our actual plastic surgery practices, you can take a look at my practice at drcalvert.com and Dr. Ravello.
RavelloPlasticSurgery.com. My phone number is 310-954-1355, or you can contact us directly through the website, RavelloPlasticSurgery.com.
You can learn about my practice at drcalvert.com, and you can reach my office by calling 310-777-8800, and that will get you an appointment either in Beverly Hills or at the Newport Beach office.
My practice is located in Beverly Hills. Our office phone number is 310-954-1355. You can also contact us directly through the website, which is RavelloPlasticSurgery.com.
We look forward to seeing you in the office for some aesthetic tune-ups.